Hello everyone, I am Dr. Avinash Chaitanya. I am a head and neck surgical oncologist working at Care Hospitals, Gachibowli. Today I am going to talk to you about thyroid swellings. As you know, thyroid is a gland in our body which is situated in the neck, and its main function is to produce the thyroid hormone. So sometimes for various reasons, maybe because of deficiency of iodine that it is classically told, and some other reasons, there will be some swellings in the thyroid gland which are called nodules, and it could be single or multiple nodules in the thyroid gland, which could be either on one side of the neck or on both sides of the neck, and this is called a multinodular goiter. Sometimes a single nodule is present and it could be hyperfunctioning or hypofunctioning. In general, multinodular goiters are associated with hypofunctionality of the thyroid gland, and generally patients are hypothyroid. It was a practice to start thyroxine tablet for them for the reduction of the reduction of the size of the swelling. But this is not the treatment. The treatment would be surgical excision of the gland. Whether half of the gland is sufficient if excised or the whole gland has to be excised for complete cure is to be decided on patient to patient basis. So what happens if there is a single nodule and it is hyperfunctioning? So hyperfunctionality will lead to thyrotoxicosis kind of symptoms or hyperthyroidism kind of symptoms, and these are like tremors, loss of weight, loss of hair, and loss of weight in the patient. And generally there will be some eye signs which you can figure out by looking at the patient, and you can say that he might be hyperthyroid, and doing a thyroid function test will confirm our diagnosis. In such kind of patients, we are generally going to give you a iodine scan, a radioactive iodine scan, by which we will know whether it is a single nodule which is hyperfunctioning or whether there are multiple nodules or a diffuse hyperfunctioning of the thyroid. Based on that, our treatment modalities will change. If it is a single hyperfunctioning nodule, surgical excision is the ideal treatment of choice, followed by thyroid supplementation for those who require it at a later stage. In other patients who are having diffuse enlarged goiters or diffuse hyperfunctioning nodules, generally we go for medical management, and if the medical management is not working as well as we expect, then we go for a total excision of the thyroid gland. So these are the surgeries done for a benign thyroid nodules. This is without cancer. If cancer comes, surgery is the only treatment of choice that is considered. Thank you.